And I will take the opportunity to announce the last session of our symposium, which is on technology with diabetes, the connected ecosystem, making sense of connected CGM apps and data dashboards. And inviting our eminent speaker, Dr. Abhijit Bhograj, who's the MD, DM, endocrinologist and healthcare entrepreneur, consultant at AI Health Clinic and Manipal Hospital. He's the faculty trainer at Abbott AGP Academy and the author of 2 chapters in the ESI textbook of endocrinology. He has organized over 400 free diabetic camps in Bengaluru village, treating 3 lakh patients free of charge, and is named Inspiring Endocrinologist of India by the Economic Times in 2018. Welcome, sir. Over to you.
So I don't know, I'm following up no screen time versus full screen time, so it's kind of going to be challenging for me. I'm just going to be as my topic is very simple, and today what I wanted to highlight is basically to look at how we are now integrating the newer technologies, and I'm sure all of you already have multiple LLMs on your phone like ChatGPT. But how are these technologies coming to help us as doctors is what we will be looking at, and how we can integrate these programs, because in the end, if you are not engaging your patients, or if you're not taking care of what needs to be done for your patients, trust me, you will lose 5 to 10% of your practice every year. Start looking at how your lab practice has come down, because people are, just because they look at discounts online, nobody is going to be doing your tests in your center. They'll go out. Same with even diabetes management. And when we talk about not just diabetes management, and when we talk about in children, adolescent type 2 diabetes as well as obesity in children is on the rise, and I'm sure all of you will agree with me. So what we are trying to say, because it is a very, very important in this group of individuals, and they're all very tech savvy, and that is why we need to be looking at these programs to engage them much more better. So looking at how we are using these systems is what I'll be looking at. But before that, let me just step back as how the standard of care used to be. So when we said, okay, I'm going to be treating type 1 diabetes, our main goal is to manage diabetes, reduce the hypoglycemia, reduce the hyperglycemia, reduce the variability, look into diet. We'll just do it with 3 data points. So most of our patients, sometimes they're not doing their SMBG. I've seen some of my type 1 kids, they are, again, they go through these phases where the lack of motivation is there, so they're not that involved. So there are times that they come with absolutely no information. And that's when I give them a encouraging push, tell them, no, look, we need to look at all these things before we, make a change. I can't just see you and then explain, make a change in your insulin. It's not possible. So that's how it used to be. We need to be looking at it. But the challenge here is such kind of outcomes, and I'm sure all of you will agree with me. The outcomes of not having information and the level of diabetes control, we have seen it in all our, quite a lot of our patients and all over India. We are not hitting the targets, and more we get these challenges of uncontrolled levels of diabetes, then definitely the population, let me just look at it, yeah. Sorry. Which is the... So the uncontrolled part of it is definitely a challenge, and definitely leads to the complications. I will be explaining what that one single point is. Now I made my case that in less data is not enough, but when you have data also, sometimes that data gets confusing. So if you look at these 3 AGP graphs here, all of them have the similar A1C. And when it comes to type 1 diabetes, there is a high risk of variability in their profile. So even though the AGP is showing normal levels, because of the hypoglycemia and the variability, the accuracy of the GMI is not going to be there. So that's also a challenge. Now, I've got one side where I have no data. Second side, I have data, but now this data is not making any sense to me. So now where are we going? Now, how do we move ahead and look at what to do in such a scenario? So most CGMs pretty straightforward. They have a filament which is implanted into the subcutaneous tissue, and this filament comes, the sensor comes with a transmitter which is connected to a platform or a software, and it's kind of like a single closed loop. And if you look at today, in another hour, you will get the Libre 2 Plus, which is real time. So the next version, we had the Pro version, now we have the Libre 2 Plus, which is equal to the Libre 3. Only difference between the Libre 3 and Libre 2 Plus is the form factor. The Libre 3 is a smaller one, but the software, the accuracy is the best in class. So all of these devices are freely available to us, and these devices exist only for one particular reason. A child who is diagnosed with type 1 diabetes has another 70 years to 80 years of their life remaining. How am I going to protect that child? How am I going to prevent every single variability, hypoglycemia? I need to know, I need the information. So now this is the challenge we all face, and this is what we are fighting. We need to fight these aspects. So thankfully now the authors of this particular consensus guidelines gave us that confidence that time in range is a metric which all of us need to be following. But again, how do I tell my patient, here please aim for 70 time in range, or aim for 7 A1C, or do that? It becomes a challenge because numbers don't make sense to most of us. If I'm telling my patient, reduce your carb load by around 15%, or take only 10 grams of fiber, these numbers don't make sense to us. So you need to be conversing with individuals living with diabetes or children living with diabetes in a way which it makes sense to all of them. And when you look at all the guidelines all over the world from 2000 onwards, thanks to COVID, it became like one big rush to adopt to technology. So that was a good thing that COVID brought to us, because we are now moving into that fast era where now technology is very, very important and makes important sense. Now, to move in a little bit more quickly, so these are 4 important steps when you're talking about starting to use data. But again, my problem here is when I come to step 3, the analytical part of it and the act part of it. The whole process of, coming to step 3, step 4 is a 40-minute process. If you're doing it correctly, it will take you anywhere between 30 to 40 minutes. So it is not something that is you can just, adopt to a certain type of practice. You need to also have a whole step-by-step approach. So these discussions, when I talk, when the guidelines are there, they're telling us, please follow all these steps and counsel your patients. So once you standardize the CGM data, then you look at the pain points in the CGM data, then you look at the analytics of that, then you choose which is the most problematic area. All of that is going to take you time. Now that is where I'm saying technology is going to come to help us to quicken this whole process. So your conversation, we are all trained to have a 5 to 10 minute conversation, and with data points we are going to make things better is what we are looking at. These step-by-step algorithms is what it was. So now I'll show you what it can be. So I'm just going to quickly move ahead because these are not my main part of what I want to be talking about. So in the end, after you do the CGM, you're supposed to choose the most difficult challenge in that CGM and make that single change. So now let's move on. Now this is a typical multiple type 1 profiles where there is hyperglycemia, there is hypoglycemia, large amount of variability and instability. So now I have one big doubt. If I don't sit and have a detailed conversation with my patient, I do not know what has led to all of these challenges. Is it insulin overdose? Is it poorly dosed? Is it poor eating, poor physical activity? So all these doubts started to come to our mind, and it became a definite challenge when it came to the management. So first important aspect, now I've got my CGM, now all of this data will go and sit in a dashboard. So first aspect of today's topic is a dashboard. So this dashboard, what you see here is the Libre view. These are, today morning I filtered around 15 of my young type 1 as well as adolescent type 1 from 10 years onwards to 26 years old. So these are my type 1. So in a static dashboard, the dashboard has to be updated on a regular basis. So you have different metrics. So every morning I can filter my cases, I can see who is above range, who is below range, and take action points based on that. So it becomes very quick. So everything is in a consolidated view. All my patients are in one view. Who has hypoglycemia, who I need to action upon. Either I do it myself or there is a team who will be looking at this data. Then this is at 12 o'clock today. This is a couple of patients who are admitted. So this is a live dashboard. So data is now coming to you every 2 minutes, it gets updated. The static dashboard needs to be updated by the user. Here live dashboard, it's doing it by itself. So using all these data points, we are now creating a platform called AI Health. So what is AI Health? We're looking at fitness, we're looking at your prescriptions, your vitals, food intake comes from food photographs, we're looking at sleep data, we're looking at CGM data. We put all of that put together, we send it to an analytical platform, and we connect the fitness expert, the dietitian, the doctor, or a specialist if required. So all of them are put together. If you say what is difference between EHR and what you are building, here there are multiple sources. So now the data is coming from, one data source comes from the CGM, one is coming from your app fitness part of it, one is coming from the food data which is like a photograph, one is coming from your sleep data. So all multiple tools that we have on our phone, we are putting it together, putting it into the analytical platform and giving you outputs which are automated. So now this platform will read what the report is. It has very clear idea now when to take action, when not to take action, when to alert you. All of these are now very much in process, and we are able to do this. Now let me just give you an example. Now if I want to filter the data, I want the platform, and this can also be, the platform can do it by itself. If I give it a prompt saying that filter every day patients who are not physically active and send a message, you need to be doing this kind of a level of physical activity, why it is important, the platform will be able to do. So this is called a dynamic dashboard. So it is using what data you have, there is some action points and there is an outcome of it. So now that is how we are now moving to advance the way we are managing lifestyle related diseases. So here I am trying to filter for only 1,000 steps. So the number of patients who had 1,000 steps, the next instruction to the bot will be send a message or try to encourage why exercise is important, give some teaching tools. So all of it can come as prompts. I don't even need to know programming. So that is the level we are working on. Here I'm trying, all the food photographs you see in the bottom which is there in the platform, I'm telling my platform, I want you to filter all the carbs less than 45 grams or more than 45 grams of carbs. You please show me all the food photographs that are there in the platform. Once it does that, I can give it a second instructions. Now you need to tell the patients about what carb is, what are the sources of carbs in your meals. All of it can be personalized. So that is how we are moving with data points and collective aspects of data in order to manage lifestyle on a day-to-day basis. So here again, the platform is summarizing the action points on the right, and I'm able to pick out the variations that are there. You can see the CGM graph. On the bottom is the food photographs, what this individual has eaten at a particular time, and we are able to correlate directly into these reports what the person has eaten, how much physical activity, and there is an output given by the AI systems on the right. So, so all of these outputs will be going easily to the individual. Here, just a typical case where, you know, the what we are trying, when the machine is doing this themselves, it is clearly highlighting this is the kind of eating pattern, these are your blood glucose for this kind of a meal. It is all very visual. So what is your blood glucose before, what is the peak blood glucose, and after 2 hours. So why this meal was wrong, all that information is there, and then these are conversations an individual is having with the bot itself. So it is highlighting that the meal, what needs to be changed, and this is the output. So how the change in behavior is happening, and the CGM is also evident that you're getting your answers. So that is how we are taking the help of technology to make a difference. Now we talk about exercise. The center screen has the CGM data and the fitness data. So if the individual is not doing enough, or they have done enough at what we have seen at 45 minutes, if they don't have a good snack, there is a dip that you see. So again, we are learning these behaviors of an individual and seeing what is the reaction with the help of exercise. Being active for more than an hour and having more than 2000 steps is where the intensity starts to come in, and that's when the variability in the blood glucose also starts to stabilize after you know, what we are looking at. So this is just a type 1 and just an individual 10-year-old young boy. His mother calls me up, says, look, he's going into frequent hypoglycemia now, what do I do? So usual conversation, you will say, okay, check his blood glucose, chart it out, come meet me after so many days. So I went, looked at the data. So now this is the day curve. So that typical day where the events are happening. It's a sharp and steep decline that you are seeing. The red highlighted points are the levels of inactivity. And on the bottom you can look at the level of activity, you know, based on each time of day. If the food data was there, I could have also shown you that what this person has eaten during that whole day. Now here I am comparing week on week data, looking at any changes in the patterns of physical activity as well as the glucose levels. So definitely those single events, then this is the conversation that I'm having with the bot. I'm trying to tell the bot, now you summarize all the hypo events that have happened, tell me what type of sharp decline hypo events that have happened is what my communication with my data is there. Then it is summarizing each of those points. So basically, once I'm able to get so much of information, I'm conversing also on that level. So what we learnt is he's dosing his insulin after about 1 hour of taking his meal. Now this is another young doctor. She has just finished her MBBS and she's also a type 1. She calls me up and she says, there's a new study that the use of GLP-1 is making a such level of analysis. So that is how we are moving ahead with the use of these technologies. You can create your whole wellness programs, home monitoring, and create a center of excellence. All of this, basis of all of this is the center and having good data. Thank you.
Okay, thank you so much, sir, for that enlightening talk. Do we have any questions from the audience? Maybe we can take 1 or 2 questions. We are having the inaugural function in the main hall. So, any questions from the audience? No. Okay, then thank you so much. Okay, 1 question.
So, how do we plan this CGM reports and the exercise we do in our integral part? How do we integrate this one?
So we've created the platform. In that platform, the CGM data is coming from the Libre. It talks to our platform. The exercise data is coming from your Google Fit or Apple Health Kit. So we are downloading the data from there. We are also asking the bot to ask questions if they have done some gym activity or they have done something very specific. So all of those points are coming. It goes to our platform. We have a very detailed report that we generate. and we use those conversations when the patient comes back. I summarize all of those reports, discuss it with the patient. So it is very very interactive as well as generated on the fly. So we're using already existing technologies to make sense and to give us the outputs.
Okay, so we'll wind up the symposium now. Thank you so much for all the speakers, Dhruvi ma'am, Elizabeth ma'am, and Ranjini Harish ma'am, and sir. Thank you so much.